Colorado is a big state where you're always active, always outdoors, always, on the go, mobile, doing something. And so, a key part to that is obviously having feet. So we need to be able to keep that, going and getting people to the level of activity or level of athletics they want to be. And that's an important part of my job, is to help them get to that point. I'm Dr. Kuhlman. I am with the Center for Spine and Orthopedics, and I specialize in podiatry, so mostly foot and ankle reconstructive surgery. Did a fellowship to essentially take on all the big, complicated cases that no one else really wanted. Tim writes, I have been under Dr. Kuhlman's care for just over 2 years. It has been a long process, but he has been the best part of it. I have never had a doctor that makes me feel so comfortable and confident about my treatment. I always look forward to seeing him and his assistant Marcy, who I might add is a joy to talk to as well. All in all, I would recommend them to anyone who is looking for a doctor who will go above and beyond. I have not read that one yet. That one's pretty touching, I'm not gonna lie to you. I'm getting choked up about it, honestly. Yeah, sorry. It definitely makes me know what I'm doing is what I was meant to do. So before I was a surgeon, I was a server, and I just couldn't do it based off the tomato thing. It just really still grosses me out that bad. Tomato's all about, and it's just disgusting. There's as simple as that. I hate the consistency, the texture, the feel. When you cut through them, there's like this hard part, and then it's moist and soft and disgusting. So yeah, I hate tomatoes. And then I was in construction for like 4 years, essentially being a mason attendant, which was probably one of my most favorite jobs, and that kind of what led me into the medical field. So, working with your hands, but I also wanted to help people. So here I am. Going from construction to medicine was a big jump, because you have to essentially, invest a lot of schooling and time into it. So I just always knew I wanted to help people and kind of be there to guide people through a difficult time. And that's kind of what made me want to do it. And as soon as I had a lot of discussions, sit down with family and friends and kind of who people were in the medical field, and I was just sold. So that's what I wanted to do. The online thing is a blessing and a curse, right? Because patients have all this breadth of information, which can lead them down a really, slippery slope of, worse and worse and worse conditions. You can get a source from a blog in, Susan's backyard or site, and it can be, terrible. And that's, what I'm here for, is to dive through what's going on with you and, give you the best information I've attained over all the years of practice and go from there. Big NFL guy. I've loved the Browns from day one. I grew up with being a Cleveland Browns fan, which has been terrible as a sports fan, because they've been awful in my entire life. Especially here in Denver, where I don't get to live down the drive or the fumble for any period of time that I talk to anybody about sports in Colorado, so it's awesome. For fun, golf, really hanging out with a lot of my friends in the area. So I've had a really good, group of friends here that have just kind of expanded over time. Doing the 14er thing. So I was really big into trying to get all the peaks in Colorado as well. My wife bought me a little book of the 14er, so I've been trying to check that off my list. It's hard to do sometimes because it is a time commitment. So doing the 14ers is another real fun thing. Some of the most important things in life, we all have our own values and traditions, but one of the most important things to me is definitely family. For me, with as a physician and a patient, for like a teamwork aspect, my job is to listen to them and use the experience and the knowledge I have to help them achieve the goal they want to get within reason. There's always things that are going to be difficult for people, but at the same time, we want to get them there and be the facilitator to that. So if they can't be non-weight bearing, I need to figure out a way to get them there with achieving a good outcome and also managing, their life's time and, what's important to them. One of the biggest people in my team is my MA, Marcy. She does so much. I can't even begin to explain to you how much she actually does for me and my patients. Without her, it would be tough. And she's just a phenomenal person and a great person to be part of my practice. The search for your condition or what's going on with you can be exhaustive for sure, because there's just so much out there. And that's where we go back to the teamwork and the honesty, and we can say we're here for you and to figure it out. That's literally my job, is to talk to you, have a conversation, figure out what's going on, come up with a game plan that works for the patient, and kind of go from there. The Center for Spine and Orthopedics is definitely about teamwork and family. I know it's hard to call work family, but in our office, that's what drove me to it, is because when I walked in those doors, it was like a giant family. I'm Dr. Kuhlman. I look forward to meeting you and helping you live a better life.